Hi, good morning. I want to thank the Academy for having me. I was really confused at first because I don't do anything specifically pain related, but it's all making sense for me now. So I hope it makes sense for you too moving forward. I have an incredible team that I work with that I will talk about as I move through. And this particular project was grant funded by the Interprofessional Practice, National Center for Interprofessional Practice and Education, and a couple of their partners. And through the course of the project, as we moved through, the community agency that this project took place in did hire me as their chief medical officer. So that's all my disclosures. And you know what I'm here to talk about, I think, at this point in time. So SHOW is a student-led clinic. It is Arizona's first tri-university project, so U of A, NAU, and ASU all participate. It's an add-on, it's a volunteer program, but student-led clinics are very good in increasing, there's evidence around increasing interest, provider interest in primary care. And you can design specific interventions for specific populations. So for SHOW, it's interprofessional practice care delivery for vulnerable populations. We do have an integrated state license, and we have demonstrated effectiveness. We started in our community actually delivering care in 2015. We measure interprofessional competency skill attainment across 4 scales, 3 designed for our students and 1 for our preceptors. We bring in not only faculty but community preceptors. Anybody, any student and any provider can come be in SHOW. And we are a learning laboratory, which is an important concept. None of us knew what we were doing. And so having that concept of we're all here to learn, we're just going to do it and we'll move through and figure it out as we go along has been really beneficial for us. So this particular project, SHOW does many things across the community, but this particular project was to facilitate interprofessional practice into a community-based setting. SHOW had a relationship with Crossroads, which is the largest substance abuse recovery residential center in the Southwest. They've been in operation since 1960. They moved from a halfway house to a treatment model, which required a state license, which required more care. Which is why they approached us, and there's their mission and their motto. I included this slide because that community concept is also really important for us. This is from the World Health Organization, and that community concept is how basically I structured SHOW. Our operation is based on this, the student-led, and that our students bring in students. It's a voluntary experience. It's student-led, the sense of ownership, and this actually matches very well with Crossroads culture. They're peer, it's a peer model, and it's 12-step, which is about community. So we had a natural culture alignment. Crossroads approached SHOW just about probably 2 months before the RFP came out on the grant, asking for more. They have a network of academic partners who provide a health assessment and a TB screener per their state license requirements. But they found as they started to contract with insurance, more complex cases were coming to them, and they did not know how to handle those cases. They are very good at substance recovery, but they didn't know the other parts of taking care of somebody. And for me, it was a unique opportunity to expose our students to the substance recovery, opioid epidemic, social determinants of health. So we started planning in 2013. And we really came along with Crossroads and said, what do you all need? What are you hoping to accomplish? And that's how we set our outcomes. We decided we were going to do two different teams within the Crossroads organization. One was going to be direct care delivery, and one was going to be health promotion. That health assessment does ask about pain. It's up there in the left corner. But we do not focus on pain. We actually ask the patient to tell us what they want to work on. And you can see it's a variety of social determinants of health. That's on the left there, bottom. And then we did a period of assessment before we actually started. And you can see out of what we collected, what scored the highest from those social determinants of health and health issues. I actually added PT onto the team because of the pain, chronic pain condition. In 2016, we measured quality improvement. We looked at length of stay. Crossroads knew that they personally could not handle the complex cases, and so that would drive people to go seek health care outside of their agency. And when someone's in residential recovery, if they leave, they don't come back. So they wanted to really look at length of stay. Did having services right in the agency increase that length of stay, let them focus on their treatment recovery, and it did. They wanted to look at patient satisfaction. Was it getting in the way, or did the patients see a benefit? And there was an increase in that. And then we looked at incident reports due to medical issues, and those were eliminated in the 2 pilot sites. Crossroads has 6 different facilities across Maricopa County. We were in 2 of them, and it eliminated all those incident reports. In 2017, we looked at return on investment. So you can see there the salary savings for Crossroads. If they had to hire this team, how much would it have cost them, and how much care did we actually deliver in dollar amounts? This was a matching grant. The community agency had to put in $50,000, and the center matched $50,000, so you can see the return on investment was very good for them. Health promotion, they actually did their own independent assessment at the different facilities, and they put together they would do their assessment, put together a program, implement the program, and then look at the outcomes. They found also, and this was OT, PT, and social work, they found that what the residents of Crossroads wanted followed very much what we were looking for in our health delivery teams, direct care teams. So you can see some of the programs they put together: exercise, family, education, vocational training, et cetera. As Liza mentioned, the National Center has a lot of resources. They were with us all the way, making sure that our teamness, how we actually were working with our community partner, that we were a team. And there are some measurements there. They are still in development, and they will be posted soon on the website. They came out at 6 months and talked to not only the organization, but show how are you doing. And then they did a case study. It's in draft, as you can see, and it will be published on their website as soon as they're done. But this was on show. So when we look at interprofessional learning, the learning continuum, it's a nice summary of what we did at Crossroads. Foundational education, really, we need to expose our healthcare professionals early on in their career. Once they get their professional identity, it's harder. So show actually our entire organization supports. We have 6 different committees that do things to support show, such as research, quality improvement, we have clinical operations, things like that. They are all undergrad, and the undergrads actually lead show. And then we have our graduate education students come in. We have about 12 different professions from Northern Arizona State. We have OT, PT, and PA. From University of Arizona, we have MD, and we have pharmacy, and we're hoping they're coming along online with a veterinary program, so we're hoping once that starts, we pull that in too. And then at ASU, we have nursing and nutrition and audiology, et cetera. Psychology, I want them soon. When you think about the enabling and interfering factors, so the community organization is a facilitator, and actually at this point in time, this project went so well, they bought a new building. They expanded their women's bed count because they knew that they needed that. We were in 2 different sites, and actually the men's site that we were in ended up not needing us once they learned care coordination and how to identify their existing resources in the community. They only need us very infrequently now, but the women's site continues to need us. And when you look at national issues, substance use in women of childbearing age is a tremendous problem. It's on the rise. So they built a new facility, and they've built a clinic in it, and it will become a learning community clinic for all the different health professional programs, and universities across Maricopa can come and actually be in there, take care of their patients, and learn. So that is actually a enabling factor. We continue to have problems financially. It's been a theme, definitely. We are grant funded, and I'm constantly struggling to find funding. I am working with 3 of the 7 health insurance payers to figure out how do we do this. These 3 do contract with Access, which is our Medicaid, Medicare program in Arizona. And so I'm in talks with them to try to figure out, what do you want to see in this patient population? How can we address that, and how do we report back? What do our outcomes look like so that we know that we're impacting your population? And learning outcomes. We talked a little bit about that as well. There is a physician competency, provider competency in substance abuse scale. But quite honestly, the thing with SHOW is that once students enter, they don't want to leave. And so in this particular, and same with our providers, and this particular experience, it was pretty small. There was only a couple of students, and they've stayed their whole entire academic career in this particular site. So my N was so small, I couldn't come up with anything. So the big take-home message for me with this is that when you create a deeply connected, integrated learning system, you can transform education and care within your community together. The strong relationship that you make with your community partners plays dividends over time. We made an impact on the care delivered by Crossroads, which is a huge organization, 400 beds. And we are getting a learning site out of it. And then you must understand the context of your practice setting. As you can tell from the assessment, we allow the patients wherever we go to tell us what they want and what works for them. Same with the organization. What do you want? Which is different than traditional healthcare profession placement. So that's also why this particular project is an exemplar for the nation. And then when I got invited to speak, again, thank you so much, I thought, pain? Huh. So I looked at Mayo in Phoenix. They have a pain clinic there, and I looked at how they were structured, and actually it's almost the exact same. We both work on functional restoration. We both have multiple disciplines in, et cetera, and we simultaneously treatment plan. Thank you.